That's the only fun we have as pain therapists, is to create pain for people. No, but it's very important when you have some problem, you feel immediately that something is wrong, but when you come to us, we find it and you get a mark on what is the problem, and that's very important. Because then it's easier to deal with mentally also. So, we remove the oxidative stress here that creates the problem, and we also remove the inflammation. And as you see, I don't know how many of you that work with patients, but we follow always the muscle's normal way to move and the normal way for the nerves to act. And that is very important. Luli. Hi, Luli. It's just my son. Just gonna have the medium. Where did I put that? Thank you. So, 7 patches. So, how much do you think it's gonna hurt in a while? The same?
No.
No. I can just show you how we check the lymphatic system. We have some points in the body where the blood, the toxins and stuff from the lymphatic system is cleaned out. And if that is blocked because the lymphatic system can get the same kind of inflammation as a muscle, it hurts. So we have one point here, right over the chest. And if you examine that every day and it hurts, it doesn't work 100%. It's tickling. No. Hurt. Lift your arms, please. And here, it's very swollen, right? Hurts? Yeah. Can you patch over his lymphatic circulation and repair? And then we can also check out, we follow the nerve structure in the shoulders. Hurts? Of course. Do you want me to check your butt as well? So because of her neck problem and the trauma she's gone through the surgery and stuff, as I just check her body a little bit, I could tell that she has fibromyalgia syndrome. She has pain everywhere, and it takes all her energy, and she's fighting it as the best way she can. And probably a really bad days, it's a lot of pills, right? Yes. So you will gonna have a really good detox. It's gonna be very, very pleasant for you. Misha and Dasha can tell you everything about that. So you can be in their fan club. Can you just for fun put on your stomach, please? Is that possible? On your stomach? Or tribu? Tribu. Okay. Do you train a lot? Huh? She was? Okay. Did you train a lot?
Yes, before.
Before? And now you stop because of your neck?
Yes.
Can you look at me up here? How does the neck feel?
Better.
It's good?
Yes.
Can you look at them? That's good. Yes, you can. Okay. Uh-oh. Don't even touch it. How many of you women think that after you get babies and stuff, look in the mirror and say, shit, my ass have fall down? Up with the hand. 1, 2, 3, 4. And one man. Did you also have a baby? Uh-oh. That's because when you have born a baby, what happens when the becken is, or pelvis is turning out, you get acute ASAP inflammation in the muscles here. That stretch out the tissue and the muscle fibers. And the problem is, after you're so stressed to focus on the baby, you forget to rehab your butt. So it's getting chronic. And when the fibers here get used to that position, and when during the night it tries to heal itself and contract and heal it, it can't. The fibers is too long. That's why you women need to pick up the butt down in the thigh. So if you practice this a lot, it will disappear. And it will come up again. Because if you take your husband when you come home on stomach, only check this and do this, it hurts, do something about it. It hurts? Okay. So if you just release your pants a little bit, we will fix you too. It's enough. It's okay. So within this attachment here, where the back and the butt muscles work together and coordinate when we're walking and stuff, if this area here is chronically inflamed, you feel the pain here. 84% of all pain we have in the body you feel in the lower back. But how many check the whole body? None. And this is what we try to teach out also. Because when you work with professional athletics, that their body is actually the way they earn money. You cannot just check an arm or a leg or whatever it is. You need to check it all. But it's also important when you have people like her that have trained a lot, because if she can't feel pain, in 1 hour she will be in the fitness center. So we can also choose, do we want to remove 100% of the pain or 50% of the pain? And that is what we do with the different combinations. Because if I remove her pain 100%, she will feel good and do everything that she's wanted to do for a long time. And if you could guess what women do first if they have had pain for a long time and don't have pain anymore, can you guess what they're doing? Someone? They start to clean the fucking house. You're laughing. You will probably also do that. Yes. I mean, you have pain for many years. I had a lady that had fibromyalgia for 20 years. And when the pain was gone, she go home and clean the house. I mean, get a life. Go to a bar and dance or do something, but clean the house. Strange. We men are better, because when we don't have pain, we drink beer. If you could see what I see now, when she got the pain and the inflammation here and the heat disappears, how the muscle contracts, that's interesting, because you can see it. Are you sleeping? No. Okay. Okay. No ischias problem. It's good. Tractus, very painful. Thigh attachment in the kneecap, painful. Tractus, painful. Okay. Not so okay. Flexor bands, painful. Painful. Oh. Is anyone want to buy a woman sheep? Just kidding. How does it feel now? Huh? What? Better? Okay. So even now when I push harder, it's better. Mm-hmm. And this? Nothing? Just little pain. Then I push deeper. Is it more pain? No? Yeah. So this is just to prove to you how fast it works and how much problem muscle inflammation can do. And, oh, maybe I should take your pants up again. Can you please come up again? Sit up. And put on the back. How do you feel? Dizzy? Oh, you're just strong. I can see in your eyes. It's happening stuff, right? Okay, I will also show you how we check the organs. Now when we have you. You're quite warm. No? Okay. Because if you have a lot of emotional stress, for example, everything is sitting here. So it's very important to check the organs. I mean, I had a young patient, 16-year-old girl that have a lot of problems in the stomach. And I told her that she'd gone with me for a while, that I wanted her to do an x-ray and tell the doctor, tell him to do a clinical examination. And he did it, and she said when she come back, he did like this. Interesting. So, we will check here. Because you have so much inflammation, it's very important to know if it's something in the intestines, the liver and stuff. And here is it quite swollen. And that means that the intestines cannot work properly. Because if the muscle tissue around the intestines here are so swollen and inflamed, it can't work. Do you have a digestive problem? No? You're very easy to go to the toilet all the time? Do you have cramps sometime?
No.
That's good. You're strong. And we also check the liver under the ribs. That's a little painful. Mm-hmm. And the stomach feels good. Spleen. Ah, not so good. And that's not so good. So here we will probably also do patching for take the inflammation away here, and then we will go for intestine function to make the stomach and all the organs around here work properly, and that will also take a lot of stress away from this area, and that will mean you will get a lot of energy back. You need it? Oh, and also here, yeah, I know. We just check the lymphatics here also. It's a little bit swollen. And the nerve center here. Does anyone want to know how you remove tooth pain? No, you don't want to know that. It's actually very easy. Because when you have tooth pain in the lower jaw, the nerve that stops here, that comes from here, if you just push here. Yeah, yeah? Oh, you have a lot of surgeons. Okay, if you push here hard and count to 10, the toothache is gone. I promise you. If you have problems with the nasal problems, the nerve that goes here up to the nose, if you push on here, if it hurts like on her, the nerve system is inflamed. And that means it doesn't work properly. So, and then you have for the eyes here, that's also very painful. Can you sit up, please? I will show you so you can see it. You should turn around. So, For us, we check everything from top to toe. So here, the nerve ends here. So if you push this, now she has pain because her nerve system is quite inflamed and sore. So that hurts, right? Yeah. And also here. So you can imagine how many, the brain needs 20% of all oxygen we have in the blood to survive. So it takes everything from us. So that means that the nerve system cannot heal itself properly. So for her, to drink more water, to breathe more, will help a lot. But before these patches, it was impossible. And also here, what effect everything that has with stress to do is also very painful. Can we get anti-inflammatory here for her jaw? And also here. So if we remove this, she will probably have it a lot better. So we do that. I must check your neck. How is it now?
Better.
It's better? Here? Also better? Oh. Oh, I must try this again. It's fun, huh?
For you.
For me, yeah. Do you want to have a job?
Yes.
How does it feel now?
Better, but a little pain.
Yeah,
Also.
because now I push very hard.
Uh-huh.
That's the only fun I have.
Only.
Yeah. No, I love to help people. So, let's see, plus, yeah. So we put a plus patch here because all of the body is actually plus and minus. Our body is actually working as a battery. So if we just have plus cells, wouldn't do anything. So we also need minus cells. And together they activate the frequency that remove the pain. And of all these patients I worked with the last 3 years that have been get rid of their problems, I haven't not one that got it in return. But I don't promise you anything, but because it's very important how much water you drink, that you listen to your body, that you come for weekly checkups until it's better. But this is just something you use until it's good, and then you stop. Then that some of them get patch addict, that's another story. Because if you had it really bad, of course it's terrible, and you get afraid to get it back. It's better? And here?
Mm-hmm.
Better?
Yes.
And here?
Yes.
Boring.
Boring, really.
Can you turn the neck that way? No.
No, neck.
Ah, I keep your shoulders. Ah. Are you sure you had the surgery?
Yes.
Okay. The other way?
Train that.
Mm-hmm. And this is done with titanium discs. Normally she wouldn't be able to do that. So to check it up, we do like this and move the head to the right. Head. To the right.